Why is therapeutic privilege controversial in healthcare? Imagine you're in a hospital, and your doctor chooses not to tell you about a serious diagnosis because they worry it might upset you too much. That's the core of therapeutic privilege. It's a practice where healthcare providers withhold information from patients if they believe sharing it could cause emotional or psychological harm. But why does this raise so many questions? Well, it all comes down to balancing two important ideas in healthcare ethics. On one side, there's the patient's right to know everything about their health. This is called informed consent. It means patients should get all the facts so they can make choices about their treatment. On the other side, doctors have a duty to do no harm, which is called beneficence. Sometimes, they think that telling the truth might cause the patient more pain or distress. That's where the controversy begins. Some argue that therapeutic privilege is a kind of paternalism. It's like the doctor deciding what's best for the patient without asking them. This can be seen as taking away the patient's control over their own health decisions. If a patient is kept in the dark, they might miss out on options like seeking a second opinion or refusing treatment. That can weaken trust between patients and doctors. There's also a risk of misuse. Because deciding when to withhold information is subjective, some healthcare providers might do it for reasons other than patient safety. Maybe they want to avoid difficult conversations or protect themselves from legal issues. This makes the practice risky and ethically questionable. Legal guidelines say that withholding information should only happen in extreme cases. For example, if telling a patient would cause immediate and serious harm, then it might be justified. But it's not meant to be a way to hide bad news just because the doctor thinks the patient can't handle it. Each case needs careful, individualized assessment. Doctors should consider the patient's emotional state, their ability to understand, and their preferences. In practice, many healthcare professionals involve ethics committees or family members to decide the best approach. They aim to eventually give full disclosure when the patient is ready. The goal is to respect the patient's rights while protecting their well-being. Still, because therapeutic privilege involves personal judgment, it can be misused or misunderstood, which is why it remains a hot topic in applied ethics and societal challenges. Ultimately, healthcare providers must find a way to be honest and compassionate at the same time. They need to communicate clearly, listen carefully, and respect each patient's unique situation. The controversy isn't about whether withholding information is ever okay, but about making sure it's done only when absolutely necessary and in the patient's best interest. That's what makes practicing informed consent so important and sometimes so complicated.